if you are suffering from sleep apnea, you may not be able to get the quality of sleep that you need. Well, there are new ways to diagnose and treat it. Dr. Kohli stopped by earlier with this useful information.
Dr. Kohli, it's so great to have you back.
Thank you, Danny. It's great to be here.
Yes, of course. Okay, so we've been talking about how to take care of our body lately. This is so important. And we've also been talking about sleep. Now, I want to talk about something specific. Sleep apnea. We hear about it a lot. We talk about it here on the show. Tell us more about what this is.
You know, this is so common, especially here in Colorado, and I feel like it's very underdiagnosed. So I'm so glad that you asked. So sleep apnea essentially is what it suggests, which is that you have apnea during sleep or lack of breathing or decrease your breathing. Now, there's two mechanisms by which that can happen. One is that your brain forgets to breathe, forgets to tell your lungs to take a breath. That's called central sleep apnea. And then the second is that your tongue or your tonsils or the muscles in your neck, when you lie down on your back especially, relax so much that they sort of close off the airway, almost like pinching a straw, and the air doesn't get in. And that's called obstructive sleep apnea. But the bottom line is the sequela of that. What happens if you're not breathing when you're sleeping is your oxygen levels go down. So your body releases stress chemicals. It goes into a stress response, which can cause high blood pressure. It can increase your risk of heart disease. It can cause metabolic disorders. It can have effects on your longevity. Of course, it can affect how you feel the next day.
Right.
You're a lot tired, you have headaches.
Yeah.
And so for all of those reasons, it's really important to make sure we start looking for sleep apnea.
Yeah, okay. I have so many questions. First, how do we know if we have sleep apnea?
You know, so the most common sign of obstructive sleep apnea, as you can imagine, when the air isn't getting in, people snore.
Yes.
Yeah, so your partner usually tells you that you're snoring a lot. Sometimes they'll say, oh, you look like you're not breathing when you're sleeping.
Okay.
Or sometimes when you startle yourself awake snoring, it's not the snoring that woke you up, it's that lack of oxygen that triggers a reaction in your brain that says, hey, you better wake up and take a breath. So all of those are signs potentially that your partner could tell you or that you yourself might observe if you startle awake that you have sleep apnea. But the next day is important too, because when you wake up in the morning, you should feel rested and refreshed.
Yeah.
If you're feeling tired during the day or having daytime sleepiness, if you're irritable, if you have headaches, all of those are signs that maybe the quality of sleep that you're getting is not quite how it should be.
Okay, so of course the big question, I'm sure those at home wondering, what do we do for this? How do we fix this?
The good news there is it's very responsive to treatment. So there's sort of two ways to fix it. One is if you have obstructive sleep apnea because you're overweight, you got to lose that weight.
Yeah.
Because as you lose weight, a lot of people can actually have their sleep apnea become much more mild, or some people even have it completely disappear. Sure. So if you've put on an extra pounds, your partner's telling you you're snoring, that may be one way to treat it. If you have an obstruction somewhere in your nose, like you have allergies, you have a nasal polyp, you have congestion in your nose, they may put you on medications like Flonase to help open up your nasal passages a little bit when you're sleeping. If you have mild sleep apnea, you can sometimes just use like a mouth guard where it kind of pulls the tongue out of the way or lifts up the jaw when you're sleeping. Those are kind of mild ways in which you can treat mild sleep apnea. But if it's more moderate or severe, then you usually need a mask either on your entire nose and mouth or just your nose that kind of pushes air in and keeps everything open.
Wow. Okay.
But the bottom line is you can't figure out how to treat it yourself. You have to talk to a medical professional, figure out how bad your sleep apnea is and what to do about it. I have a friend who has mild sleep apnea, and he tapes a golf ball onto the back of his pajamas because then whenever he rolls onto his back, which is when he has the sleep apnea because these muscles are relaxing, he just kind of is not comfortable, rolls back onto his side, and then that airway just opens right up.
Easy fix right there. That's a great one. Oh my gosh. Okay, well, guys at home, that means if your partner is telling you you're snoring, you might not want to ignore it and roll your eyes. We all do it, I know. But seriously, it sounds like it could be maybe potentially something a little bit more serious. Dr. Kohli, thank you so much.
My pleasure.
And you can follow Dr. Kohli on social media. And if you have a topic or question for Dr. Kohli, message us on our Facebook page, Colorado and Company on 9 News. Your topic may just end up on the show.